Hey guys, Dr. Eric Smith at Optimal Health Chiropractic and Rehabilitation in downtown Chicago. And today I have IFBB Pro Aiden Marcus. He's here today because he's got a few things going on. And so Aiden, right now you're getting ready for a show, but you're also training people, right? Chicago area?
Correct. So I have a company called Addict Fitness. We do contest prep. We also do body transformation as well.
That's awesome. I've seen some of his clients at the gym, and the work they do is pretty amazing, and obviously he has a great physique. So one thing that he's coming in for, though, in terms of getting ready for the show, is he has a lot of lower back pain going on. So I have a little model here. This is basically a piece of the lumbar spine, and just to kind of sum it up from what I found in the examination is he has what we call facet syndrome. So this is the front of your spine, this is the back, and this is typically the little bones that you can feel in the back yourself if you try to do that right now. That is these pieces here. And then you have a lot of muscle over here. And what he's done, and what I see a lot, is people get this posture we call lower cross syndrome, which is just a muscular imbalance, which then leads to too much pressure on these facet joints. And the type of pain that you're going to feel if you have facet syndrome is usually pain going up the back, up the lower back there, and then sometimes into the buttock region. And that can cause some other things. So what we don't want is that continued pressure to cause some other disc issues and such, as well as you said you got some, what's the pain up here?
A lot of tightness in the traps.
Okay.
As well, yeah. Neck and traps.
As you can see, he's got some muscle up there. So tight traps, and we don't want that to lead into other neck issues, because if you're not aware, all the muscles that go into your arm, or all the nerves that go to the muscles in your arm, come out of your neck. So if you have extra compression there, then he's not going to be able to fire those muscles, or even you yourself might not be able to use that in your workouts, your day-to-day living, eating, drinking, anything like that. So we want to show you what we're going to do for these types of things. And if you have any questions, feel free to let us know. But I'm going to start off with having you go ahead and lay face down.
Let's do it.
So over when I was doing the examination, there was definitely a lot of tight musculature on him. He's drinking a ton of water. He knows how to take care of his body in terms of health and such like that. He's aware that some of these signs and symptoms that he has going on are just not where he wants to be. So that's why we're going to do some stretching and such to just get his lower back to loosen up before we get into the adjustment of this guy. So he also did say he's got some stuff going on with his knees. So we're going to take care of that. And I'm just going to really start from the ground up with him. Get his spine going, work on his legs as well, and then also get into his neck and upper back. So one of the things why this is so helpful is because as we stretch out the lower back, he's laying down. So now he doesn't have to use that musculature, but even doing this, I can feel his muscles trying to fight with me a little bit. So getting them loosened up should help out quite a bit in terms of when we go to adjust him and do a few things here. I always wonder when people watch our videos where you guys are from. So if you're watching this right now, you get a chance, write in the comments below where you are, where you're located. So I know we have a lot of people in the Chicago area that check out these videos. We also have a lot of people that are all over the world. So it's always interesting to hear that and see where people come from. So just give yourself a little shout out in the comments below, and we'd love to hear from you. So, okay. So I'm going to have you slide down the table just a little bit more. There we go. Some of the things that we're going to do here just to get these hips loosened up is you're going to feel this kind of pop up below you. Here in a sec. Bring it down. It's complained of a lot more on the left side than the right. Cool. We're going to get into your thoracics, get this loosened up for you so we can open up your rib cage. We're just going to let those just relax deep down there. So go ahead and take a nice deep breath for me, please. Let that all the way out. Good. There we there. Get right in that side that you said you were having some pain. And relax. Good. Okay, let's have you lay on your right side. Face the wall for me, please. So with him, we're going to focus a lot on getting his lumbar spine to move. He's been more of in an extended position, so what I want to do is kind of open those joints up. I'm going to bring your leg up like this. Just let that drop for me. Let this hamstring relax as much as you can. Good. Let's go to the other side. Drop this. Same thing. So with him, I don't want to induce more extension. I'm going to come in and open this up a little bit. Just relax for me. Good. Awesome. Go ahead and lay on your back for me. So he had also complained of knee pain. So he has a lot of compression just from some other like little accidents that have happened along the way. So before I get into his upper back there, I want to get into his knee a little bit. It's a little traction move that I like to do after we open up the hip here. Good. And then just trying to work his medial lateral meniscus. Crunchy in there.
Yeah. Wow.
And the point of that is to get his femur and his tibia to be articulating the way it should and not have as much rotation on there. And adjust your ankle. Let this relax for me. Good. Perfect. Nice little pop in there.
Yeah, that's out.
Let's relax. Good. I like to do that move quite a bit. A lot of times it's hard for you to open up your own joints through there or even get the pressure off your ankle. So it's a kind of a move I learned in chiropractic school. I've been doing it ever since. So. Have you been getting any headaches?
Yeah.
More on the left side or the right?
Mostly the left, I would say. Most of the headaches I can tell are tension related.
You can feel them kind of starting back here and wrapping around, or what would you explain to your headaches?
That's it. Starting back there, moving its way up. Yeah.
It's going to test your range of motion. Pretty tight through there, so I'm just going to bring this up, back up again. There we go. And then just let your head relax into my hands. Good. Good. Awesome. You doing okay?
Yeah.
Still feel your toes?
Yep.
Bad chiropractic joke, I guess. Stretch you out. All right, muscle man, now I'm going to get the middle of your back.
All right.
Okay, take care of this. I'm going to roll you to your side. Nice deep breath for me. Let it all the way out. A little hug from me. Good. Awesome. Okay, let's have you sit up. Swing your legs around that way. Let's try to move your head in a full circle. How does it feel?
Good. A lot looser. A little crunchy.
A little crunchy, right? Yeah, exactly. So I want to see how much range of motion we increase. So go ahead and stand up for me.
Okay.
Face that way. Let's have you go ahead and try to slowly bend over and touch your toes for me. Still muscularly tight, but how's the lower back feel?
Better. It feels better. Range of motion is better than when we started.
Yeah, definitely. So now the next piece that we're going to add to this, so I'm going to do some cold laser on his neck. It's been a while since they've been adjusted. Actually, I've one adjustment before in your life, right? Just one?
Just one.
Yeah. So we're going to make sure the inflammation doesn't start to bother and get those muscles tight again. So we're going to use some cold laser on his upper back and his lower back, and as well as we're going to do some spinal decompression today. So if that looks like anything that you need or anything that's going on with your body and need some help, answer some questions, feel free to give us some comments below or give our office a call. Aiden, appreciate you coming in.
Thank you very much.
Looking forward to you competing and seeing you at the gym.
I needed this. Thank you.
You're welcome.